Well, thanks for joining us today. I'm Dr. Doug Evans, Chair of the Department of Surgery at the Medical College of Wisconsin. And I'm really fortunate to be with Mr. Donald Jenkins, who's one of my patients. And we're doing a series of what we hope you will agree are inspirational videos telling the story of healthcare from the standpoint of many of our patients. And I always call my patients by their formal name, so I always say, Mr. Jenkins. It's hard for me to call my patients by their first name, and actually this comes from when my dad, who passed away a few years ago, went to see the doctor probably when he was in his early 80s, and I was talking to him one day, and he said, you know, my doctor called me by my first name. He said, I hope you always call your patients by Mr. or Mrs. or doctor or whatever it should be. And I've kind of, since I always did what my dad told me to do, I've never forgot that. But anyway, we're trying to provide information that will be of help to patients as they journey the healthcare navigation on their own, which is really, I think, the perfect segue into your story. And we'd love to hear about it, because I know how to navigate a new diagnosis of pancreas cancer was one of the big things for you.
Yeah, I'd say, you know, obviously with no family history, absolutely no indications, no risk factors, no lifestyle factors, it kind of was certainly a big surprise. And I think the thing for me that I think may help other people is, you know, what do you do when you're faced with the enormity of a diagnosis that completely comes out of the blue? So for me, you know, I was out of town with my son at an Air Force event, and had noticed I had some back pain and also different minor symptoms with the different colored urine. I went to my doctor, my primary care doctor, who ran some tests and found out I had elevated liver enzymes, which is very atypical considering I just had a physical. That led to some diagnostic imaging, which then led to an ultimate diagnosis of early stage pancreatic cancer, which obviously is something that no one wants to hear. So what I did to try to figure out how to deal with the enormity of that is break down my approach into two different things. One was research and education, and one was a very proactive, positive mental attitude and building a plan.
And I think your case was kind of unique, and I think there'll be many people who have a family member, a friend, or even a personal association with the Pancreatic Cancer Challenge. And in way of history, pancreatic cancer right now is the second leading cause of adult cancer death in the state of Wisconsin, and soon to be in the country, because it affects nice people, Mr. Jenkins being one of those really nice people. But it's not associated with any lifestyle modifiable risk factor. So lung cancer is on the decline because people aren't smoking as much. Colon cancer is being more effectively treated because people are getting colonoscopies. Breast cancer more effectively treated because people are getting, women are getting mammograms, predominantly women. Pancreatic cancer, that's not the situation. Your case was particularly complex because you had a CT scan that looked like it was a localized tumor to the pancreas, but you had a blood test or a biomarker, the so-called CA19-9, which was very high. So I think you had a varied spectrum of optimism and pessimism, as I recall, from the physician community, and you had seen a number of doctors, right?
Right. So, you know, I think the first thing that I did was to try to educate myself and to try to understand, you know, I used my primary care doctor. I used meetings with some very high-level oncologists. I actually used a resource called the PanCan Network, which was incredibly helpful. They have, I had a personal counselor that was assigned to me that would answer my questions and provide me with research. And by knitting together this mosaic of knowledge and meeting with oncologists, meeting with my gastroenterologist, I learned a lot about the stage. I learned a lot about the treatment options. I learned a lot about what the roadmap would look like. And when I took all that information, I learned that I was a surgical candidate. And then that begged the question, what do I do? And so through a series of referrals, I was actually able to connect up with several surgeons who cemented my understanding, gave me an idea of what my roadmap might look like, and that's how I came across Dr. Evans and decided on pursuing a course of treatment at Frodert, which was neoadjuvant therapy, which I did closer to my home, followed by chemoradiation, followed by surgery.
And take us through maybe start with the chemotherapy and the radiation part. What were the kind of some of the challenges, and how did you, I mean, obviously one of the unique aspects of you and your just your inner strength and your emotional strength is, I can't even imagine the hours you invested in reading, and somehow you found the strength to do that. I think many patients with a cancer diagnosis get a little bit understandably depressed about that or upset about it, and so reading about it is not something that would come natural for them. How did, I mean, you put in, this was like a PhD dissertation, the amount of research time that you put into this, and how did you do that without getting overly upset about things?
Well, that's a good question. I think my default was I am going to try to control everything that I can control, and I'm going to build a medical team that can help me with the things that I can't. And so I really wanted to understand, you know, I wasn't able to, because I didn't know anything about this disease, I wasn't able to really make head or tails of one treatment plan versus another. I just had to put faith in the people that I was interacting with that would design a plan that was most appropriate for me. Once that was the case, I just naturally, by my nature, wanted to know everything there was to know about what that journey was going to look like. And for chemotherapy, I was mostly concerned about, you know, the thing that's most unnerving is it going to work? If it's going to work, how well is it going to work? If it doesn't work, what are the options that you can pursue? And I didn't really look at any of that. I was really focused more on the tactical side of things, which is what's my journey going to look like? What are the side effects going to look like? How am I going to manage those? And the way that I chose to do that was to read as much as I could on NCBI and American Cancer Society and PanCan Network, and talking with Dr. Evans. He's got some nurse practitioners on staff that turned out to be absolutely instrumental in me gaining a comfort level and confidence level and being able to navigate my journey. And what I found was, you know, you'll find in the media or in the literature that sometimes things conflict themselves with one particular approach versus another. But at the end of the day, you build a knowledge base that I think gives you more comfort and more confidence to be able to get through your course of treatment. And then when you add that on to the expertise of your clinical team, it puts you in a position where you know you can get through it.
Yeah. It is worth mentioning that our nurse practitioners on the outpatient side and our physician's assistants on the inpatient side are all specialty specific. So, for example, on the outpatient side, you probably you probably have Gabby and Natalie on your phone, and they're there. You can dial them up 24/7 pretty much, and they've been with us for so long, and their knowledge base about chemotherapy, radiation, about pancreatic cancer, it truly is amazing, right?
It was, because obviously you're going to have knowledge gaps, and in order to be able to fill those knowledge gaps, you need someone, whether it's Dr. Evans or a nurse practitioner or your oncologist, to fill in those gaps and allow you to put together a plan. Because one of the things that I found as a new patient was, not only did I have to educate myself, but I had to build a plan. I had to select a surgeon. I had to select an oncologist. I had to select a facility. I had, all of these things that I had to do, which were quote unquote to-dos that I had never done before. And I think as you iteratively go through the process, you build your knowledge, you use a proactive mindset to control what you can control. You start seeing the results of that effort by marching through the various stages of the process. When I got to the chemo radiation piece, I'd already been through chemotherapy, and that was really an uneventful process for me. But again, it gave me a lot of confidence that I was doing everything that I could possibly do in order to maximize the best outcome possible for surgery.
Yeah. And then about a month after the radiation finished, because I think you had about 4 months of chemotherapy, and then radiation, and your radiation was given over about 5 weeks, 5.5 weeks?
Yes.
And then 4 weeks off, and then an operation. How was, I think many people who will watch this video may be facing a pancreas operation or a big abdominal operation for colon cancer or for something else. How did you prepare yourself, emotionally and physically, and then what was the experience like?
Well, I think the first beginning part was incredibly encouraging, because once I stopped all the treatments, a lot of the symptoms and comorbidities started going away. Mm-hmm. And so that gave me a mental and physical level of energy to see positively that I was getting to the point where I could start taking more proactive measures. And two of the biggest things that I decided to focus on was nutrition and physical conditioning.
Sure.
Because you provided me with the booklet.
Yep.
It's like a 30 or 40 page booklet, which I read repeatedly. And two of the biggest things was nutrition and physical conditioning. And there was actually a little physical conditioning plan in the book, given the nature of the surgery. So I focused really heavily on dealing with or talking to the on-staff dietitian, who was phenomenally helpful, and then also built a physical conditioning plan that I executed at a gym for the 8 weeks prior to the surgery. And the result of that was that my outcomes and my recovery, in my opinion, was significantly faster and much less eventful, and I felt much more confident about myself going in and coming back out.
I think one of the things that people watching this video will realize is you really, with this diagnosis, you were able to devote a tremendous amount of time and personal energy to your problem and trying to maximize your ability to get better. And one of the things that any adult, and especially older adults, struggle with is, especially if they're working full time, or even if they're retired when they get a cancer diagnosis, their routine changes, and they have to all of a sudden they are asked to take a full-time job doing something that isn't that much fun. And many of us here believe that there's a strong connection between the mind and the body. One of the things that you were really uniquely successful at doing was prioritizing this diagnosis. And I know that sounds almost counterintuitive, but people have trouble doing that. How did you kind of put everything aside and just get laser focused on this new problem and how to have the best result?
Well, that's interesting that you say that, because I agree with you 100% on the mind-body connection, and I decided that this was not going to define me. This was a problem that I had, a serious problem that I had, that I wasn't able to address on my own. So I needed to surround myself with a top-notch medical team. And in order to do that, I wanted to learn everything I possibly could learn, but I compartmentalized the process of dealing with this from turning this into something that was my identity.
Yeah.
because I continued with my life. I continued with working in my firm. I continued with my family and taking care of my dog. And this was, a pocket of effort that was required to be done, but it was only that pocket.
Yeah.
And the key is that to me is that this is something that does have a lot of things that you can control, and I would say that you want to control everything that you can control. Rely on your team for the things that you can't, but don't let it be your identity.
Yeah. Such great words of wisdom, just so great. Well, in our last 30 seconds, how are you doing now? And do you have a final message for all those people that are, if you take yourself back maybe 6 months ago, what final words of advice and inspiration can you give them?
Well, I'm doing great. I feel fantastic. I don't have any lingering effects from any of the treatments, which is I'm very grateful for. And I would just say the last piece, and I'm, as of right now, I have no discernible disease in my body, which is phenomenal.
Great.
But I would just say, break it down, break the process down into pieces, educate yourself, and be very proactive, build a team, and know that between your own personal control and mental attitude and the expertise of your medical team, that you can get through this. Mine was a 10-month journey, but I'm sitting here right now having this wonderful conversation with Dr. Evans, and I think that other patients could very easily do the same.
Oh, that's great. Mr. Donald Jenkins, thanks so much. And best of luck to you. And we're going to remain in very close contact. And I know Gabby and Natalie will be very upset if you don't call them at least every couple weeks. So
Thank you, Doctor.
thanks so much.
You're welcome.